Good afternoon, everyone. This is Dr. Ritesh Bansal. I am a consultant diabetologist and physician. I am based in Delhi. I am practicing in Saroj Diabetes and Research Center. This afternoon we will be talking about hypertension and what is hypertension, what should be the target BP, and how we can control blood pressure through lifestyle modifications. So hypertension is basically high blood pressure. So usually we have many values, many figures, many guidelines which say different things, but usually we follow, maybe if we go according to International Society for Hypertension. So they usually say that hypertension or blood pressure is usually the normal BP should be systolic, should be less than 130, and diastolic, that should be 85. To simplify it, the BP should be less than 130, 85. So that society, again, the same society mentions that the BP will be high normal if the blood pressure readings is between 130 to 139 systolic or 85 to 89 diastolic. So that will be labeled as high normal. And then they label grade 1 blood pressure or grade 1 hypertension to be systolic blood pressure to be more than equal to 140 or diastolic blood pressure to be more than equal to 90. So any of the reading, if on repeated measurement it is more than 140 or equal to 140, or diastolic more than equal to 90, that will be labeled as grade 1 hypertension. Again, grade 2 hypertension is um, uh, systolic blood pressure more than 160 and diastolic blood pressure more than 100. So this is all about the values. So in nutshell, we just need to remember the value of 130, 85. If it is less than 130, 85, you are having normal blood pressure. If it is more than that, we need to achieve, or we need to maintain towards the value of less than 130, 85. So usually if we see the Indian context, the number of hypertension, the patients who are having hypertension is quite high. The prevalence is roughly, it accounts for almost 20% of the young adults are facing hypertension. So that accounts for almost 1 in every 5 individual is suffering from hypertension or uncontrolled blood pressure. So the problem with the Indian diet is usually when we see what is the reason behind, obviously we can't control the ethnicity, the race, but beyond that, we have certain factors which which are taken into account and which are basically responsible for high blood pressure. That is the diet part. So we always, the Indian diet is always rich in salt. So the sodium part, the salt part of our diet is more than what we need. So WHO recommends that the diet should be having not more than 5 grams of salt, or maybe 2 grams of sodium. That should be the upper limit of intake. But when we see Indian diet, usually the intake is more than that. So we usually consume double the amount. That is roughly we are taking 8 to 10 grams of salt in a day, or maybe roughly 4 grams of sodium in a day. So how we can basically control that part? So if we see the diet part, we usually have, we relish on a number of things which are rich in salt, like papads, chutney, achar. We usually pour salt over the top. Over the top, salt intake is on the higher side over salads, different dishes, maybe. That thing should be taken care of. So by consuming maybe less of papad, less of chutney, less of achar, we can definitely control our salt or sodium intake. So usually I advise patients to cut down on their all these things, packet things, maybe processed food. They should be restricted, or quantity should be restricted to, so that we can restrict our total salt or sodium intake. So what we can do in place of those things, we can definitely change from high salt intake things to maybe natural things, like we can maybe add herbs or spices, so that we can have more flavor, and again we can relish our food. Second, we can avoid processed food which are often rich in salt, or third thing which we can do, avoid putting over the top salt. So all these things can definitely bring down or cut down our total salt intake. And apart from that, yes, definitely physical activity is one of the main factor which can control hypertension or blood pressure. Because again, if we do when we are basically physically active, we are maintaining a balanced weight, we are sweating, again that will result in loss of some electrolytes. All these factors, if we take into consideration, like maintaining a balanced diet with fruits and vegetables, by adding herbs, by adding spices, by doing physical activity of 30 to 40 minutes, by maybe drinking lots of fluids. All these factors will help in control of blood pressure. So, in the nutshell, hypertension should be controlled because high blood pressure can result in many complications. It can cause cardiac issues. It can cause diabetic retinopathy, or sorry, hypertensive retinopathy, we can say in hypertension part. It can cause nephropathy. It can cause neuropathy also. So diabetes and blood pressure, they usually are the two culprits which affect most of our organs. So if we can control both these things, hypertension and diabetes, we can somehow cut down on the complication part. So as I mentioned, for hypertension, cutting down of salt, physical activity, and lastly, maintaining a well balanced diet can be helpful. Thank you.